Joining me now, Jose Arrieta, Chief Information Officer at the Department of Health and Human Services, Lori Ruderman, Senior Advisor for the HHS Buy Smarter Initiative, and Tom Dowd, Federal Health Leader at KPMG. Thanks all very much for joining me. I appreciate it. First of all, Jose, congratulations. First time I've seen you since you've become the CIO at HHS. A lot of eyebrows raised because you're not historically an IT person. Your background's more in acquisition. How does that inform the way that you look at your priorities as you become the CIO at HHS?
I think that the eyebrow raising doesn't inform any of the priorities, and thank you very much for the congratulations. Yes. I appreciate it. I think that my priorities are pretty much focused on a couple things. What can we actually take and implement in our environment quickly so that we can get an idea of how we can move the organization forward? Focused in three areas. How can we facilitate easier moves to cloud, more strategic move to cloud? I want to take technology developed in DISA, which is behavioral-based technology to create identity access at the edge of a network. I want to deploy it within HHS. I want to test it. So you no longer need multi-factor identification. We can actually have identification that occurs on the edge of a network on a wireless device based on how you behave with it. And then I can use that insight and that experience to go out and talk to the national healthcare industry and say to the national healthcare industry, look, we use Qualcomm Snapdragon chips. We use them in a Google phone. We created behavior at the edge. Maybe you guys can consider doing this in the IoT space and the national healthcare space, and to create a ripple effect and change in industry. We're partnering with DISA on that. We're really excited about that opportunity. So those are the types of things I want to do, is take things that we can actually implement, create change within the organization, disrupt, move data to a cloud environment, separate data from business process, and create some functionality that will actually benefit users within our environment.
And that last piece is the piece that I think is the most important there, Jose, because it doesn't sound like you're talking about technology. You're talking about technology as a vehicle to deliver better healthcare outcomes, the whole point of the mission of the organization.
That's right, and what we learned with HHS Accelerate is we learned that we could take $24.2 billion in spend over a 10-year period of time and 100,000 contracts every year. We could move it to a cloud environment, index it on a blockchain, use a containerized microservices architecture to actually automate that business process. Now that added a ton of value for acquisition professionals, but what we learned beyond that is when we go and talk about that openly in industry, it creates an understanding in industry that they too can transform themselves, which drives change in the healthcare industry, and that's important. In government, we may not be able to have the biggest change to the entire space, but if we can identify problems and we can make a change, and then the industry base can follow our lead and maybe push it even further, we can have a positive impact. So I think that's the way that I'm thinking about the new role. I'm really excited about it, and it'll be fun.
Lori, you're in a great spot because HHS has been kind of on the cutting edge of how to do all of these things acquisition-wise for a long time, since Brian Civic was there a number of years ago. What are you working on right now to help deliver from the acquisition perspective of what Jose's talking about?
We're actually using the new technologies to standardize our processes, but we're also leveraging group purchasing activities. So looking at CDC, NIH, and FDA, where they buy the exact same things and having one contract instead of three. It'll streamline and we get the economies of scale. And we wouldn't be able to do that without the new and emerging technologies and without the effort Jose's put forth.
What are the things that you're seeing so far that appear to be a logical fit for that? Are there commonalities that you've discovered pretty quickly among those three organizations and others inside the agency?
Actually, there are. We're looking at three different of GSA's categories in category management, professional services, medical and labs, medical and IT.
What is the way, how are you looking at all of that? Not just from an acquisition perspective, but from healthcare providers will have this stuff, mission delivery providers inside HHS will have this stuff and be able to do their jobs better?
Well, we've consolidated across HHS under the Reimagine umbrella, and so all of the heads of contracting activity within HHS are working together on this effort. And we've analyzed HHS's spend, the first to 18-month analysis. So we were able to look at the spend across the department, both from an artificial intelligence perspective, but we compared it to the spend under management reporting that we do to make sure that our data lines up and is as accurate as possible.
Tom, what's your takeaway on what you've heard, and how does it fit with what you're hearing from your customers and clients all across government?
Well, I think what Jose and Lori are referring to is really kind of expanding the definition of health IT, right? I think a number of years ago we thought of health IT as electronic health records, EMRs, e-prescribing, all very important technologies. But I think where they're going with this is really expanding the definition of that, really building out an ecosystem that not only is limited to the federal government and what they're providing, but also working into the industry as well. So, you know, it's going to be a lot more complex. There's going to be a lot more data, but I think that it gives us that much more opportunity to really start to focus on patient outcomes and citizen outcomes going forward.
Is data driving that expansion, or are there other factors there that you see?
Well, I think one of the other factors that we're really focused on that has a technology component as well as kind of the human element of it is really around customer experience. And that customer could be a citizen that's receiving some sort of a benefit, Social Security benefit, Medicare beneficiary, what have you. That's a really important focus for the federal government right now. And I think even when we think about kind of some of the internal things that we're talking about here at HHS, eventually that's going to lead to money going back into the programs, supporting the missions, and eventually supporting those citizens, the patients, the ones that are receiving those benefits.
So the customer experience piece is where I want to go next, and I'm curious how that informs, thinking about customer experience, whether it's an internal or an external customer, how that informs the way that you go about doing what you do. Lori, why don't you go first?
Well, we've seen a lot of change in customer expectations. They want a similar experience in their interface with the government that they have in their personal lives. And technology's changed our personal lives so much in the past 10 to 20 years, and the government is really working to catch up to meet the customer's needs.
Jose?
Yeah, I think I was down at CDC last week, and I saw something very interesting. So folks that were having open heart surgery were all getting sick with a bug, right? The CDC guys are there to identify what the bugs are. And they went back and they looked at the experience in the operating room, and they found that there's this machine that when you take the heart out of the human body, it cools and heats up the heart to keep it alive. They found that the machine in the fan was carrying the bug. And they went back through the supply chain through an analytical process, and they actually identified that someplace in Munich, Germany, in a manufacturing facility, this is where this was actually occurring. And then they communicated that through the supply chain, and changes were made to improve the quality of care for that customer that's getting open heart surgery. And for me, when I think about my job as the CIO, that's our role. And our role is then to be able to articulate how that could improve the expectations for whomever the customer is, whether it's the public health first responder in the field that needs data to do their jobs in the event of a public health emergency response effort, or whether it's an individual that's doing acquisition up in CMS to support their large financial system. So that's the way I look at it.
Tom, this is an interesting question. Jose mentioned supply chain, which is not something I expected to come up in a discussion about health IT, but it's obviously important, and I wonder if the same principles of supply chain management apply in the healthcare field, in the healthcare IT field, as they do as they might in the Defense Department or any other department.
Absolutely, absolutely. We, in fact, there is an initiative that KPMG is a part of right now with the Food and Drug Administration to look at the supply chain and finding ways to use blockchain to secure that supply chain. You know, a lot of the drug development is taking place outside of the United States. There are a lot of different points along that supply chain, and so there is a lot more going on in the supply chain than we probably previously even thought of, just even probably 5 years ago.
What is your sense of the way that, Lori talked about customer expectations, how is that evolving, and how do you expect that to continue to evolve so that these folks and others like them can anticipate that and can prepare for what customers want to see coming?
Well, what's interesting is that, you know, going back to what Jose and Lori were talking about is certainly focusing on an internal customer that indirectly does impact an external customer, say a citizen. So the definition of a customer is fairly broad. We need to keep that in mind. But I also think that, as Lori had mentioned, we are starting to see that the government wants to deliver the same type of experience as we're seeing in the commercial sector right now. That needs to be seamless. And so I think one of the things that KPMG is focused on is what we call the 6 pillars. And I would say that this is true whether it's in the private sector or the government sector. Number one of those pillars, and probably the most important, is around personalization, right? Truly understanding who your customer is, what types of services they want, their expectations, and how they want those services to be delivered and in what form. I think the other piece too, where we're seeing a lot of emphasis, is around integrity. So we go back to, what type of data do we need to service that customer? That comes from a number of different sources, but it has to be secured, right? So those are two examples, I think, of as we go forward, that whether it's in the private sector or in the government sector, those are some really important elements of trying to improve that customer experience.
What's the data flow in your view now as you walk into this role, Jose, at HHS? And what would you like to see happen to that data flow during your tenure?
Yeah, I mean, I think for me, data is really important. And I want to hear more about the blockchain project after the show.
Big blockchain guy.
But I think that moving data from legacy mainframe-based systems, organizing it, separating data from business process, and then allowing access to data through an attestation layer when it's needed and when you have a key that says you should have access to it to execute a business process is the key. So you can do that if you, in a smart manner, move to a commercial cloud environment. And I'd like to see us increase the pace with which we move to cloud. I'd also like to see us be a little bit more specific with how we're moving to cloud. Are we moving a customized set of capabilities like CDC surveillance capability to a cloud environment, which is probably going to create a different need? Or are we taking an administrative function like human resources, and are we moving it from an on-prem COT technology serviced environment to a commercial cloud environment where we may be able to use commercial off-the-shelf technologies to actually facilitate that business process. So I'd like to see the discussion center on those two paths and separating data from business process so that we can maintain the integrity of the data and we have flexibility from an execution perspective at the individual level within the organization. And that's the way that I really think about it. And I think when you heard, when he was talking about the blockchain project that they're doing and how they're looking through the supply chain, the only way that you can successfully execute that is if you separate data from business process.
Lori, what tools do you have to be able to deliver on that vision that Jose is talking about there?
Well, thanks to Jose, we're actually building our requirements on the Accelerate model that he created, and so we're really looking forward to that. We're actually building artificial intelligence capabilities to analyze contract data. But the challenge we're facing is the data's unstructured. A lot of it is free-form text. So even though the technologies are really exciting, it does take some work. It's not a magic wand. So we have subject matter experts that have to look at the data and verify it is what it is. It's the way we're saying things differently with the same words. So we have to work on that.
It's a change in the way we do business. No longer is your job to send an email to the IT department and ask for something to be changed next quarter. When your wife asks you to take out the trash, do you say, honey, I'm going to do it next quarter?
I would like to.
But we want to be able to, in an agile manner, adjust to the customer's need within a week, within a couple days. But it requires the customer to have a regular engagement about issues with the data, and then how can we improve that so that it evolves and constantly gets better. And I think that's what Lori's describing, and she's been leading that effort across HHS and doing a fantastic job at it with her team in the Buy Smarter initiative.
Jose, Lori, and Tom, thanks all very much for joining me. I appreciate it.
Thank you.
Thank you very much.
Sir.
Up next, I'll shift focus from smarter IT at the Department of Health and Human Services to how the National Cancer Institute and the Defense Healthcare Management Systems are addressing this revolution. More health IT when this episode of the Tech Leadership Series continues. Stay with us.
The Tech Leadership Series, Health IT, is brought to you in part by KPMG. Learn more at read.kpmg.us/fedhealth.